All right, so we started the recording. I'm going to share my screen. Screen 2. Right now, you're probably just seeing something with my son on it, a baseball player. But once I start this presentation, there you go. You should be able to see my lead page, The Truth About Plantar Fasciitis and Foot Pain. Thank you for being here. My name is Troy Vandermolen. As I've already said before, we've got a chat icon, so if you want to use that at any time tonight to ask questions, to give responses, that's great. I'm going to give you my contact information as well, so if you want to reach out to me directly. If you respond to any of those emails you've been getting as a reminder of your signing up and registering for this event, you can email through that too. That doesn't get to me directly, but Tassie, the one that's already communicating with me about this issue, we'll get that and she'll forward it my way too. We used to do these things in person a lot, and then COVID hit, we had to kind of pivot on this. So in person, it's really easy to interact. It's a little bit different through this virtual session. And if any of you did your hair tonight because you thought you were going to be on the screen, you're not, you can't see, I can't see any of you. You hopefully can see and you can hear me. Who in the world am I? Well, let me tell you just a little bit about myself. My name is Troy Vandermolen. I'm a graduate of the University of Iowa Physical Therapy Education Program way back in 1996 is when I got my master's degree in physical therapy. And then I went on to get a doctorate degree through evidence in motion about 10 years ago. I've got, it's more now. I'm going to do the math, over 25, almost 26 years of experience as a physical therapist, primarily in outpatient environment, seeing people with musculoskeletal issues of all types. In our environment, low back pain is the #1 reason people come to see us. Neck and shoulder related issues are #2. And then all other orthopedic conditions are pretty close at #3. Ankle and foot pain and knee pain are similar in frequency. And so seeing a ton of people in my 26 years with ankle and foot pain. I did a little assessment of our clinic. We have 7 clinic locations. And in the last 3 years, I think we've done over 20,000 treatment sessions with people with ankle and foot pain. So you're dealing with someone here tonight who's seen a lot of this, who's worked with a lot of people. And I'm really proud of my education at the University of Iowa. It's a great program. I learned a ton. But what you're going to hear about tonight are the things that really are become obvious when you've just worked with a lot of people over time. You can learn about things in a textbook, but once you start to work with people, see trends and patterns that develop as you work with people, trying something and trying other things and figuring out what works, that's when you really learn a ton. And so I'm proud to do that. My company has been around since 1998. We're about ready to start our 8th clinic location in Albia, Iowa in January of 23. We got about 27 or 28 physical therapists. All in all, we have about 42 providers, including occupational therapists, a variety of assistants and athletic trainers. All of us are trained in musculoskeletal issues. We have this unique training called 3D movement analysis and performance. 3D maps is the easy way of remembering that. And the point I'm telling you with this is something you're going to hear more about tonight. And I think it's an important one. Understanding how the body functions in space between gravity and the ground, how the body part that hurts interacts with everything around it is really important. The thing that hurts in your body doesn't exist in a vacuum. It exists in an environment, and that environment influences what that tissue experiences. And you're going to learn tonight that your foot pain issue is more than likely a symptom and not the problem in and of itself. The symptom develops because of a root issue, a core problem. And that is the key to solutions that last. And so that's really what we're going to talk about tonight. It's important to learn that, because if you want to get something taken care of once and for all, you got to get to the root of the problem. And that's a big reason why we get a lot of students that come through our clinics. They know that they're going to learn unique things that are successful. And we're proud to be a clinical educator for a lot of the PT programs throughout the state of Iowa and beyond. You might be sitting there saying, I'm not sure this is for me. So let's talk just a little bit about who this workshop is for. #1, there are a lot of people that come to this workshop that feel like, man, I've tried things, it's not helped. I've tried ignoring it for a while, that hasn't helped. It's not horrible, but it's definitely getting worse, and I'm afraid it's going to continue to get worse. And some are even saying, man, it's so bad, I'm stopping to doing some of the things that I really love to do. people get some concern that if they stop doing things, they're going to be able to do less and will become more dependent upon others. And so if that's your reality, if you already are becoming more dependent upon others or fear that you will, this is a great place for you to be tonight. If you've got this nagging pain that has been around for a while and has progressively worsened, it's natural to start asking questions like these. What in the world do I need to do? Will it ever go away? Maybe I just need a surgery or some kind of a surgical intervention that can help me. If I can't move well, I can't exercise well because of the pain, what's that going to do to my overall health? And that is a really, really good question. I'm going to point out one really important thing in just a couple slides pertaining to that fact. It's clear that when we hurt, it's hard to be in a good mood, right? Body, mind, and spirit. What happens in the body can have an impact on the mind and on the spirit, and vice versa. When we hurt, it's hard to be in a good mood, and we tend to have a harder time having a positive impact on those around us. This is a truth. We're going to learn about this tonight, specifically with regarding your foot as well. In life, we influence those closest to us the most, and we are influenced by those closest to us. That is truth. And when we hurt, it's hard to be a positive influence on those around us. Your foot is the same way, okay? Your foot is influenced by the things around it. And sometimes the solution to making your foot pain go away is to look around it at that environment a little bit more as well. The traditional way of dealing with many musculoskeletal issues is this. We're going to go see a doctor. The doctor is going to say, man, you hurt. I can tell that. I want to do something for you. So you often get prescribed medications, and they might help temporarily make it feel better, but that's treating a symptom. It's not getting to the root of the problem. And when the pain returns, because we haven't gotten to the root of the problem, usually it's a little bit worse, and it progressively worsens over time. And as a result, we do diagnostic tests, and those tests show us problems, and those problems have solutions. Maybe, but those tend to be higher risk procedures dealing with the symptom and the side effects. They do not still get to the root of the problem. And all too often, people have tried medications, injections, surgeries, and the like, and still continue to have pain, which is a really frustrating thing. So if you have been on that merry-go-round, the traditional way of dealing with musculoskeletal issues, this is a great workshop for you. Almost all of you here, I would expect, would say, I just want to move better. I want to move more comfortably. I want to reduce my pain. Now, this workshop tonight is for some people. It's also not for some people. I wish I could tell you that there was a quick fix. You do this one thing and all your problems are going to go away. Believe me, if you go on the web, if you go to Google and say solutions for foot pain, you're going to get tons of options. Lots of people making big promises. Usually you don't get rid of the pain, it just gets rid of some of your money. And that's not a good solution. I wish I could tell you that there is a quick fix. I can tell you that there is a solution. It's not a snap your fingers solution, but if you find and fix the root of the problem over time, you eliminate the stress on the tissue that hurts and it feels better. So I can promise you this. I can enhance your function and reduce your pain if you have an issue that's pertinent to this situation. And I'm going to ask you an important question in just a little bit to determine whether the approach that we take will be beneficial for you. In fact, it's as good a time as ever to do this. Again, I'm going to ask you to click on that chat button, and you're going to answer a couple questions here today. Answer this question first. Is there a specific activity that if you do this, you know it's going to make your foot and ankle or plantar fascia issue worse? Is there something specific that makes that issue hurt worse? If so, type in that chat box what that is. And then in response to that, as a follow-up to that, I want you to answer two other questions. How bad does the pain get on the 1 to 10 scale? Okay, so hear me out on this. 1 is really, really minor, and 10 is it's emergency room level pain. It's the worst imaginable pain, okay? And then the next question is, how long have you been dealing with it? And you don't have to be absolutely specific. Has it been days, weeks, months, or years? Okay, so all right, we're getting some responses here. Excessive exercise, got a pickleball player here, basketball player, there we go. So functional wear and tear, pounding, weight-bearing activities. Diane says walking. Holly says walking and running. Diane's pain level can get up to a 6, so moderate levels of pain, not emergency room pains, but Yeah, when you get 5, 6, 7 in that, it's definitely catching your attention for sure. Sean says manageable as long as the ice and roll on it. Mike says mowing the lawn on an incline in particular. It could be a 9. It's been around for years. 6 months for Diane. Pain scale 7 for Kyle. Only after exercising, not while exercising. Okay, that's interesting. Kyle, I can give you some thoughts on that. Holly says 4 or 5 on the pain scale, past few months. Carol says standing and walking, pain level 6, last spring, 18 months for Kyle. Joyce says wearing shoes other than athletic shoes. We're going to talk a little bit about shoes tonight, Joyce, so I'm glad you brought that up. 5 to 7 pain, wearing shoes that rub on my hammer toes. Yes, Polly. We're going to talk specifically about a foot deformity. It's not specifically hammer toes, but again, some of the same rules apply to the hammer toes as it does to some of these other foot deformities. Okay, so here's the deal. I asked you this question for a reason. If you can say, yes, there is something that makes it worse, in a weird way, that's actually kind of good news. And I'm going to tell you why that's good news in a little bit. The other 2 questions about how bad it is and how long you've been experiencing it, that won't give me an indication of whether you can be helped, but it will tell me maybe how significant it is and therefore how long it will take for you to get benefit. If it's been around for a lot longer period of time and the pain scale is higher, that's a more irritable condition that generally takes a little bit more time to get to your ultimate end result, positive end result. But you can get benefit if you have a specific activity that causes pain, because we know that that tells us that we have a mechanical issue. So here's a good saying. If your pain is reproducible, it's actually also likely to be reducible. Okay, so look at the things that I wrote on here. I didn't know what you guys were going to say, but I've got several things that you already told me are on here. Walking, standing, running, climbing stairs, yard work, housework, exercise. People with plantar fascia related issues, arch pain or heel pain, those first steps in the morning, those first steps after periods of non-weight bearing, sitting for a period of time, that can be really uncomfortable as well. All those things are not good. We don't like to experience those things, but I'm going to restate this again. If your pain is reproducible with a particular activity, it's also reducible, because we know that that pain issue has a mechanical feature associated with that. And I'll tell you a little bit more about mechanical in a little bit, but let's first talk about 2 types of trauma. And I'm going to show this to you in graphical form. When you hear the word trauma, there's a certain connotation that we think of in our brain, right? The thing that we naturally think about when we hear trauma is acute trauma. And this is what acute trauma looks like. Sudden tissue damage, and then over time, it slowly improves, right? There's a direct cause and effect. When you do something that causes immediate pain, you know, that's one specific event that brings on the tissue damage. And then over time, because we're organic human beings that are made to heal, it gets better over time. So, you know, people that have broken a foot bone, people that have twisted their ankle, that's sudden pain because a tissue gets stretched beyond its thresholds and there's damage that occurs. The effect of that damage is immediately noticed with significant pain. And then we do things to kind of take the stress off that tissue, and slowly but surely it gets better over time. Here's the point about acute trauma. It's real. We see some of this in the clinic for sure. Acute trauma is made to get better because the issue that brought it on, that sudden trauma, is not something you repeatedly experience. And as a result, the body goes through the natural healing process. Okay, so acute trauma is real, but in our reality, in the clinic that I work in the human experience, cumulative issues are much more frustrating and real because it's not one incident that brings it on. It's lots of little incidents that bring this on. So it looks different. Cumulative trauma is slowly progressive changes in the tissue over time. Now that arrow went up and up for a few seconds here, but in real life, that process could take months, if not years. And you can see the symptom threshold, right? There was stuff happening down here at the lower level that we weren't even aware of. The tissue is changing, but we don't feel any discomfort or pain yet. So we don't know it. And most of the people, when they start to cross that symptom threshold, would say things like this: it's not that big of a deal. I mean, I can deal with it. It's not the worst, but it doesn't feel normal, but I can live with it, right? And as a result, most people kind of ignore it for a little while, thinking, well, maybe that'll go away. Maybe they'll take a little over-the-counter ibuprofen or Tylenol or something like that. And it might feel better temporarily, but because we haven't got to the root of the problem as time goes by, it tends to be that the pain becomes more frequent, more intense, more significant in time and duration. So you might be asking yourself, why in the world does it have these buckets on here? Well, I'm kind of a visual learner, and I want you to learn about cumulative trauma using this bucket analogy, okay? When the body wears out over time, which is definitely going to happen, we're not made to last forever, right? There are some very insidious, gradual things that happen. They're actually quite predictable. The first sign that your body is changing, that tissue is changing, is that we are more apt to experience fatigue, okay? So I'm 50 years old, a little over 50. I've been a physical therapist half my life. A PT is not a labor-intensive job, right? I'm on my feet a lot, I move around a lot, but I'm not lifting heavy things, I'm not shoveling, I'm not pushing and pulling hard. I can tell you though that after 25 years of doing this, I have more fatigue at the end of the day and at the end of the week than I used to, because my body is changing. And for those of you that have to do a lot of stuff on your feet, if you do pretty manual work, you probably realize this sooner than most. We're not spring chickens any longer, right? And so when a little water starts to fill the bucket, it's fatigue. If that water continues, which it does because we ignore fatigue and just think it's going to get better, pretty soon that becomes a bigger issue. And now we start to say that we're not really comfortable. It's not pain yet, but people start to say there's some stiffness, there's some soreness. It's not just fatigue. It doesn't feel quite right, right? But still, it's not horrible. And so most people don't do anything, or if they do, it's just home interventions to help deal with the pain. And so again, as time goes by, more water fills that bucket. And eventually people come to the realization it's not just tiredness, it's not just stiffness and soreness, it hurts. This thing really hurts. We've been traveling down that cumulative trauma pathway a little bit longer now. We haven't had an overflow yet, but that's next. When we have an overflow, there's true tissue damage, which definitely takes much more time, effort, energy, and money to get rid of that thing. The goal of this workshop is to get you moving back in that direction towards fatigue and stay away from this overflowing of your bucket. So that's what we're going to talk about tonight. Now, look at my screen. You see that image in the back? That's a railroad track. If you look really closely in the distance, rounding the corner, you can see a train that's approaching you as you stand in the middle of those railroad tracks. Now, if we were actually on this railroad track, we would get some light signs and symptoms that this train is on the way. You know, long before you even see it, you might start to feel a little rumbling on the tracks and maybe hear a whistle, a train horn in the distance. And as that train gets closer and closer, that sound and that noise gets more and more noticeable. The vibration picks up. And as it gets even closer still, we realize we better get off this track or we're going to have troubles. That's how cumulative trauma advances, little by little. And the measures of that advancement are frequency, intensity, and duration. Early on, people say it's not terribly frequent, it's not terribly intense, it doesn't last long. When I notice it, it's just there. And then as time goes by, they start to say, yeah, it's definitely happening more often than it used to, and it hurts more than it used to, and it takes longer for it to kind of settle down again, and I'm experiencing it much more often than I used to. And the problem with that is not that just that we don't like to experience pain, but when we hurt, because there are specific things that we do that contribute to that pain, we do them less. We move less, and the impact of that is not just on your foot. There's a general health impact too. There are 6 things that Americans spend 86% of their healthcare dollars on. I'm going to say them in order. Number 1 is musculoskeletal issues. The number 1 healthcare spend, about 20% of dollars, healthcare dollars in America. I think it's $200 billion every year spent on musculoskeletal issues. And then in order, it's heart disease, I think cancer, then diabetes, obesity, and depression. Those are the top 6. 5 of those top 6 are directly related to how much and how well we move. Our musculoskeletal issues, our heart disease, diabetes, unless it's juvenile diabetes, the adult onset diabetes type 2, is movement related. Obesity and depression, all those things are made worse when we move worse and move less, and are made better when we move more and we move better. And so I'm talking to you today about ways to move better so you don't bother the tissue that's giving you signs and symptoms. But what I'm talking about has a broader scope where it will have a much greater impact beyond just your movement capabilities and your musculoskeletal issues. Your overall general health is positively influenced by being able to move better and to move more often. My goal is for you to see the doctor less, to take less medication, to avoid surgeries if at all possible. Or if you're going to have a surgery, make sure you get the benefit out of that surgery that you need. Now, most people, when we deal with problems, we'll deal with it in a very predictable way as well. Normally, when I do this, I'm at my house. I've got a house that was built in 1915. When we moved in about 7 years ago, the insurance adjuster came and said, yeah, we'll insure you. We're just not going to insure that roof. The shingles were really bad. And it was a big house with a big roof with a big price tag to change it. And I'm looking on the inside of my house at my ceiling and saying, you know, I don't see any spots of water. It's not that big of a problem yet, right? So I put off fixing that problem. I ignored it. Eventually, if I continue to ignore it, bigger problems would occur. I'm thankful to tell you, 2 years ago, I spent the money and got it fixed, and it's all well and good. But think about this with regard to your musculoskeletal issues, right? When they're at the start, where they're not so frequent, not so intense, not so long in duration, many people will ignore it for a while. You know, it's not that big of a deal. We don't like to be squeaky wheels, right? It's going to go away, right? But when it doesn't, when it gets more frequent, more intense, and longer in duration, then we figure out maybe we got to do something about it. The problem at that point is most of the solutions that we try to employ for this don't get to the root of the problem. These are just things that mask the problem, alters the symptom. In fact, even in the musculoskeletal world, I have to say, I have to apologize. Medications, injections, surgeries, those don't get to the root of the problem. They just kind of alter your experience with the symptom. Even in my world, ultrasounds, the electrical stimulations, they don't get to the root of the problem. They just make us feel better. Now don't hear what I'm not saying. It's good to feel better. There's a reason to do some treatments if they can make you feel better. I just want you to understand that until we fix the root of the problem, we haven't given you a solution that lasts. And so my challenge to you tonight is not to ignore the problem anymore. And if you're here listening to me tonight, you're probably not ignoring it anymore. Most of you have sought solutions, and most of those solutions, unfortunately, are alternate solutions, masket solutions. My challenge to you tonight is to find the root of the problem, fix it by solving it at the core. So that's where we're going tonight. In order to understand why that's so important, there's one key principle I want you to understand. When we hurt, it's natural that we think of our problem like a medical condition, but I'm telling you, this isn't a medical condition. It's a mechanical issue. There's primarily a mechanical issue at fault here. So what I mean by that is this. Let me give you an analogy first. Think about a beautiful summer day. The sun's out, it's about 75 degrees, very little breeze, and you can go out for a cruise in your favorite vehicle. Maybe you got a convertible, you can put the top down. It's beautiful, right? It's a picture perfect Sunday afternoon drive. And suddenly the light goes on in the dashboard of that car, okay? So if you're like most, you're gonna be like, that thing can't be relied upon. That thing comes on all the time. I don't trust it. In fact, I don't hear anything. I don't see anything. I don't smell anything. It's not a problem. So we keep going. Now imagine we keep going and we keep going, and eventually we start to feel a little rattle. And maybe we hear a little bit of sound associated with that. Maybe we start to see a little smoke come out and more lights come on the dashboard. The problem is definitely getting worse, right? So we pull off on the side of the road and we pop the hood and then we pop the trunk. So imagine this, you walk outside of your car and you go to the trunk, because in your trunk, you got this big old thick blanket. And you grab this blanket and you walk to the front, the hood's up, and you throw that blanket on the engine compartment, excuse me, and you slam that hood. Okay, and then you go to your car, because in the glove box, you remember you got some duct tape in there, and you're gonna take this duct tape, and over that dashboard light, you're gonna cover up the light on the dashboard with your duct tape. Off you go. Can't see the problem, can't smell the problem, can't hear the problem. I fixed the problem. That's what dealing with mechanical issues with a medical intervention does, okay? You cannot successfully manage a biomechanical problem with a biochemistry treatment. If we pop pills to deal with pain, and that pain has a mechanical origin, we're just chemically altering the pain and not altering the mechanical origin of the problem. And we wouldn't think about trying to do something silly like that with our car, which we know is a mechanical intervention, right? We got to get it fixed mechanically. And so what I'm encouraging you to do is to see your body not as a medical problem, but as a mechanical problem that requires a mechanical fix. It's a movement-based problem that needs a movement-based solution from people that understand proper and effective, efficient movement. Now, let me challenge you just a little bit more before we get into some key concepts here. There are 4 phases to healing. Anytime you have an injury to the body part, external or internal, the body's going to go through these phases. I'm not going to get deep in the weeds with this, but I want you to look at phase number 2. See what that says? Inflammation. Now, be honest with me. When you hear that you have some inflammation, what's your natural tendency? We are conditioned to do what if we're experiencing inflammation? We got this really cool over-the-counter product that's an anti-inflammatory. Ibuprofen, taking it high enough and consistent enough levels, has anti-inflammatory properties. There are also prescription anti-inflammatories. We are trained that if we're experiencing inflammation, we're got to get rid of that inflammation. Now, taking an anti-inflammatory can make us feel better because reducing inflammation feels good. Inflammation gives us a sign and a symptom, but it's a sign and a symptom that the body needs to go through a natural process. If we can experience that inflammation, the inflammation is actually when all this new vasculature starts to develop at the cellular level. And over time, when we go into phase 3, proliferation, phase 4, maturation, those things mature and develop, and there's this big network of vasculature to supply that tissue with what it needs to be healthy. So think about this from the perspective of a heart attack. Sad story. Mike Leach passed away. Many of you maybe know a very interesting and good football coach at the college level, age 61 from a massive heart attack. Those occur when vasculature that feeds the heart gets blocked. And so the muscle of the heart can't get the nutrients it needs to survive. Now that happens all over the body at different tissues. It's just not as critical as what it happens to the heart, because the heart is absolutely necessary to sustain life. If your muscle doesn't get the nutrients it needs, it's in trouble. Your body goes through the same thing. If it does not get supplied with everything the blood is intended to provide, oxygen and nutrients, that tissue is not going to be healthy and it's going to break down more quickly. That's why reducing the inflammation makes us feel better. But if we don't create this vasculature doesn't grow in this area, the tissues are starving yet, and they're more apt to be negatively influenced by mechanical wear and tear over time. So my encouragement to you is this: don't hop quickly on the anti-inflammatory bandwagon. You need to experience the process of health. You need to take the stress off that tissue and let blood return to that tissue so that it can experience what it needs to maintain its health. Let me tell you a quick story about a client of mine. This is several years ago. She saw me when she was 38 years old. She and her husband had recently been on an anniversary trip to Hawaii, and I've never been there, but Hawaii has lots of trails that you can walk on. They're all lava trails, so they're not necessarily even. They're hard. They've done a lot of walking and exercising, and she started to develop some foot and heel pain. She was a very active person. She liked to do CrossFit and other workout routines. She came home and tried to continue to do those things, and it progressively worsened. So she went and saw the doctor, and kind of the typical stuff had happened. She had gotten some medications that helped for a little while, but it came back. Eventually did a diagnostic test. They found there was some issue at the heel where the fascia origin was. So they did an anti-inflammatory injection to that tissue. Again, some temporary relief, but it came back, and she realized maybe I shouldn't be doing CrossFit. She started reducing her activity, and it wasn't good for her. And she finally got to me as kind of a last-ditch effort. And she admitted to me she wasn't very optimistic when she came to me, because she had seemingly tried everything and been experiencing it for nearly a year by this point. I'm not going to go into all the details because I'm going to tell you some of this stuff lately, but you would think, she's got a foot problem, right? And I will tell you, no, she had foot pain. She had tissue that was experiencing inflammation at the foot for sure. But we found by doing a very simple assessment of her mobility, her function, her motion, her three-dimensional movement and performance, that the root problem was really a hip issue. And I'll tell you why that was the case for her later. But let's go and let's talk a little bit about these types of foot pain. I want to show you a little bit first about how your foot was designed to move. And your foot's not unique. It's like every body part. It moves three-dimensionally. Okay, so for a demonstration of three-dimensional movement, think about your spine. Okay, you can flex and extend your spine. Okay, that's sagittal plane movement. You can side bend to the left and to the right. That's called frontal plane movement. And then you can rotate to the left and to the right. That's transverse plane movement. Every body part, every joint moves three-dimensionally, a combination of sagittal, frontal, and transverse plane movement. Your foot is the same. Your foot's actually really quite unique. I think, 26 bones in the foot, lots of ligaments, connective tissues, muscles, and stuff that support and give you an arch. When the heel lands and we go to foot flat, the heel moves in such a way that the midfoot releases and we pronate. It's an unlocking of the foot that allows the foot to kind of more closely interact with the surface underneath it. It makes it a mobile adapter when you're on uneven surfaces. And then what body moves over the foot, and as soon as the heel lifts, that arch tightens up again. It's called the windlass effect. It occurs when the heel lifts and the great toe extends, that foot tightens back up, and now it becomes a rigid lever that we can propel ourselves forward to the next foot where we land and the same thing occurs. The very three-dimensional movement pattern to enable the body to land by moving in all three of those planes so the foot can adapt to the ground and eventually propel itself as a rigid lever. In fact, instead of just describing it to you, let me show this to you. I'm going to play this video. It's showing just the bones of the foot. There's no ligaments, muscles, tendons, anything like that. But you will see how this arch right here is the inside look of your arch. This is the arch of your foot. And the heel has not hit the ground. So this arch is nice and curved, okay? It's like a bell-shaped curve. You'll see in a little bit that as that heel lands, that arch will drop. That's called pronation, and that's the foot becoming a mobile adapter. There, the arch drops, okay? So it's really flattened out. As soon as this heel lifts, you'll see this thing bow back up. Now it's a rigid lever propelling our body forward. We're going to see it from an oblique angle. Again, you'll really see this arch as soon as the foot gets flat, really spring down, and then it'll snap and lock as the heel lifts again. That very naturally happens under normal circumstances. From this angle, you'll see that heel actually move a little bit. Let me pull it back a little bit. Notice how the heel has a little bit of an angle to it, and as soon as it hits the ground, it kind of straightens out. That's what happens with an arch foot. That heel is actually doing something called eversion. As the foot adapts to the ground beneath it. You can't see it lock back up as much from this forward view, but I'll assure you that that is happening. That's what naturally happens when the foot does what it's intended to do. Unfortunately, for a lot of you, the foot doesn't do that particularly well. And one of the things we have to consider is what environment the foot is in. If I could go back to Bible times when people walked around in not very supportive sandals most of the time, it was basically a piece of leather tied to the foot with rope and string. Didn't have much arch support back then. My guess is that the body adapted to those demands, and it was a different day and time where people were very active. Our feet are impacted by the environment that we put it in. And so you can see this is a fairly normal foot. There's supposed to be a straight line down the ray through the toe. That toe is bending in when it's not surrounded by a shoe at this moment, but you can see definitely how much bend occurs when we confine it to a narrow shoe. This happens to be high heels. So imagine this, you've got a narrower toe box, but you also have the heel lifted. So all the force, when we're just standing there, is moving towards the toe of that foot. Now, again, this is cumulative, right? Wearing arches for a day, a week, a month, a year is probably not that big of a deal, but over time, cumulatively, there's this progressive impact on how the foot positions itself. You know, in Asian cultures, small feet were seen as something of value, so they bound feet. Well, those feet didn't function like normal feet. In a sense, we are binding our feet to some degree based upon the shoe wear that we wear. And the biggest culprit of this are shoes with heels and a narrow toe box for sure. But anything that reduces the splaying ability of the toes, that prevents us from maintaining alignment of that great toe from the ray to the tip of the toe, it has some impact on the foot's ability to pronate and eventually supinate and become a rigid lever. So think about that too. A lot of people ask me, what shoes do I need to wear? And I'm going to tell you this. I do have some preferred shoes, but my goal is to enable your foot and the parts around it to move so well that we're not dependent upon great shoes to function. I think it's more about what shoes we should not wear than it is what shoes we should wear. We should wear shoes that allow us to spread the toes a little bit more. Now, temporarily, we might need some arch support, but ultimately, I think as we function better and better, we can reduce our demand for arch support. I would want you to have something with minimal arch, not a lift at the heel, and a wider toe box ultimately to allow the foot to function just as well within the shoe as it would without the shoe under normal circumstances. Now, again, we're going to talk about the types of foot pain, the three most common types of foot pain. I want you to understand that what I'm doing here is basically just describing the pain. We're not talking about cause here. What caused this? I'm just giving you a description, giving you a diagnosis. These are easily the three most common types of foot pain. But I want you to hear what I said before. You may not fit any of these categories, but when we talking a little bit about what causes these things, if they're mechanical in nature, the same cause can contribute to bunions in some people, and other people plantar fascia issues, and other people Achilles tendon-related issues, and in other people neuroma issues. And for those of you that have tingling, soreness, and pain around the middle toe, that's probably a neuroma-related issue. Again, I don't have any slides on that tonight, but I can describe that to you as we get to it. A bunion, obviously, I think we all know what a bunion looks like. Instead of having that straight line from the ray through the toe, that toe starts to bend inward. Sometimes it even starts to overlap with the second toe. That creates this protrusion on the inside of that ball of your foot. It's usually very stiff and sore. If you pull up on your big toe, you should be able to lift that toe compared to the ray that it's connected to 50, 60, 70 degrees, in some cases more. People that have bunions can hardly extend the toe at all. And if you can't extend your toe and you haven't developed bunions yet, you are at risk for developing a bunion because the normal motion at your toe is going to come elsewhere. If this toe can't extend, it starts to move inward. This is the accommodation that that foot makes. And that is very often the result of the environments that we put our feet in. I get asked quite a bit, is this a familial issue? Is it like hereditary related stuff? I don't know for sure if it is, and there's probably smarter people than me that can answer that question. My belief, however, is that it's more pertaining to environment than it is nature. It's more nurture than it is nature, because these environments are very common. They're becoming less common over time. But I just had a 17-year-old girl at one of our clinics come in for treatment after she had her first bunion. I think she's scheduled to have her second bunion surgery any day now. So this can happen at any age. It tends to be more common as we get older and older, just because the wear and tear, cumulative effect of that environment and the movement impact that environment has builds over time. Let's talk about plantar fascia related issues. So what we're seeing here is the fascia. It connects to the bottom of the heel and runs. It's very narrow at the bottom of the heel, and then it kind of fans out as it goes towards the toe. There's one bundle that goes to the big toe, one to the second toe, third, fourth, and fifth toe. So it gets wider. This is what makes up the arch of that foot, and it's intended to have some springiness to it. When we have plantar fascia, this area becomes irritated and inflamed. And most people will say, I primarily, or at least initially, feel it at the heel. As it gets worse, it does tend to travel into the arch more and more. These people will say those first steps in the morning or after periods of non-weight-bearing seated rest are really uncomfortable. We can't usually see it to the naked eye. Well, if we looked at that under the microscope, we would start to see that there are just really small tears of that connective tissue where that fiber connects to the heel. It's called microfailure, and that creates an inflammatory effect. And guess what? Take an anti-inflammatory, give it an injection, make that inflammation go away. It'll feel better. But if the forces that are creating all the tension that's causing the microfailure to occur have not been remedied, have not been eliminated, it's going to come back. And it's probably going to get worse as time goes by. So we need to figure out why in the world is that tissue experiencing that amount of cumulative stress where we have this mechanical wear and tear process that's building up over time. And what's interesting is it's often referred to as plantar fasciitis, but if you've had it for longer than 12 weeks, it's not an active inflammation anymore. It turns into an osis. And what I mean by that is it's just a pathological tissue. When that tissue gets inflammation, the tissue weakens. There's the microfailure. We might make that inflammation go away, but that tissue is still weak. That stress is going to re-irritate it. More failure is going to occur. You're left with a tissue that can't handle tension stress. It handles it worse and worse over time. So less stress leads to more symptomatic response over time. And again, a reminder, getting rid of the inflammation is not the solution. We need to get rid of the stress that's causing the inflammation, allow the body to go through the natural healing so that tissue gets better blood supply. A lot of these cumulative wear and tear issues, whether it's at the foot, at the knee, at the shoulder, at the back, or at these white tissues, fibrosis, fibrotic tissues, connective tissues like tendons and ligaments, those tissues don't get as much natural blood supply, and therefore it's harder to get them the nutrition that they need. And then when we treat that with an anti-inflammatory approach, we're further stunting that natural wound healing process. Now, Achilles tendonitis at the foot, that's called it's a fibrous connective tissue. At the back of your heel into the Achilles tendon, it's truly a tendon. It's similar but different fiber. But the problem is the same. We get wear and tear that's cumulative enough that we start to get microfailures occurring at that tissue. These people will hurt with first steps as well. So it's not going to hurt on the bottom of the heel. It's going to hurt on the backside of the heel instead. So this is very, very similar to plantar fasciitis related issue. It's just a different part that's wearing out more quickly. Now, we can give people heel lifts for a little while that will take some of the mechanical stress off that tissue, but that will ultimately lead to compensations elsewhere, which aren't good. We need that foot to learn how to be a rigid lever and a mobile adapter better and better again. And a little hint, that's not always a foot-related problem. In fact, that's a great segue into the final section here tonight. What are the true causes of foot pain? Now, remember, I talked about every body part has to move three-dimensionally, right? And every body part has a kind of a threshold of movement, a normal range of movement that is healthy. If we lack movement and have way too much stability, that's not healthy. If we have way too much mobility, that's not healthy either. We need to be somewhere in the middle between this balance of mobility and stability. Health is in the middle. I've made up this funny word called mo-stability, a combination of mobility and stability. So when people have body parts that are way too mobile, there's consequences over time, cumulatively, mechanical consequences for that extra mobility. Likewise, not enough mobility, too much stability has consequences as well. Neighbors tend to compensate for poor motion at a particular area. And it's those things that compensate, that experience the wear and tear, that eventually leads to pain that starts with low frequency, low intensity, low duration, but cumulatively builds over time. The problem is not at its root the tissue that hurts, but the tissue that needs to have a balance of mobility and stability restored. So we're going to talk about 3 areas. For Heather, I told you it was her hips. For a lot of people, their foot problem is really a hip problem. We're going to talk about mid to upper back, and we're going to talk about the ankle and foot too, because we can't ignore that. All right, so hips. Remember, a balance of mobility and stability. If your hips are too stiff, that's a problem. Other parts are going to make up for lost motion to this. If your hips are too mobile, it's a problem too, because other parts get carried along for the ride when your hips are too mobile. Now, hips can be a common culprit for lots of musculoskeletal issues. The most common cause for knee and back issues are hip-related problems because those are the closest neighbors to the hips. But hips are a really common problem for people with foot problems too. For a moment, take a look at this picture. This is a muscle group starting from your spine and also from your pelvis that goes across the front of the hip and connects into your femur. These are your hip flexor muscles. Now, again, remember I talked about Bible times, how people were pretty active back then. To get places, you generally had to walk to get to places. It's just recent that we have enough technological advancements that we can be more sedentary at work. We sit behind desks and at computers and in vehicles. And so instead of our hips being extended when we stand, they're in this 90-degree position, which puts your hip flexors in a shortened position. And when your hip flexors are in a shortened position long enough, they will adapt to that shortened position so that when we stand, there's tension. That tension can pull forward on your spine, giving you too much inward curve at your low back. That can be problematic for your back. It can limit the motion at the hip and give you issues of compensation of movement below it at the knee. And your foot as well can compensate for lack of motion at the hips. So let me show this to you. This is a gentleman who has a tight hip flexor group. It's a left hip flexor tightness issue. And you're going to see a compensation that occurs at his foot because he can't fully get through his left hip as he strides on the right. It's going to create what's called an abductor twist or a heel twist. You're going to see 2 strides. The first one, you'll see this little twist a little bit. On the second step, you'll see it quite a lot. So take a close look at this. There's a little twist right here. And then he lands with the toe forward. And as soon as he gets through, that foot really has to push out. That's not normal. I'm going to show you that one more time. Normally, the heel comes straight over that toe. The toe doesn't have to move out like that. So that extra motion at the foot has consequences where there are tissues at the foot who are created to experience a certain amount of stress, where if they experience a higher degree of stress, again, for a day, a week, a month, not that big of a deal. But cumulatively, over and over again, with every step you take, 20% more force has 20% greater consequences over time. So that can lead to compensatory stresses at the toe, at the heel, on the bottom of the heel, at the back of the heel, at the Achilles tendon, or by the third toe, where you have a Morton's neuroma. There's a little nerve ending there that can get pinched and irritated, and then that thing starts to give you symptoms. Kyle, you said you don't really feel it when you move, but when you're done, if that thing's been getting pinched, it's going to start to inflame just a little bit. Now the mechanical pressure that comes from the buildup of that inflammation will push on that nerve, that neuroma, and give you that sensation. My guess would be, Kyle, if it's not that big of a deal now, that's good. But it's like the warning sign coming on in your dashboard. Hey, there's something going on here. You better look into it. Check that engine, right? And if you don't check the engine, pretty soon you're going to have some grinding of the gears and some of the smells and the sounds that go along with it. Okay. So one of the ways to reduce stress on your feet and take away the mechanical problems that can exist there would be to make sure the hip has good Mo stability. It's kind of the Goldilocks principle. We talk about that a lot in our clinic. Goldilocks said, I don't want the bed to be too hard or too soft. I want it to be just right. That porridge, one was too hot, one was too cold. I wanted just right. We want just right motion. We want Goldilocks, not too much, not too little. And if your hip isn't doing what it's designed to do, something else is. And that can put your back, your knee, and your foot at risk. What about your mid to upper back? That kind of seems funny. That's even farther away from your foot, right? Well, if you can, I want you to stand right now. Okay, so hopefully you can still hear my voice if you can't see me. Stand up, and I don't want you to look at your foot. I I want you to keep half your weight on each foot, okay? And in your mind's eye, I want you to feel what's happening at your right arch, okay? Can you feel your right arch in your mind? Now, without looking at your foot, while you're feeling that right arch in your mind, I want you to turn your shoulders and rotate to the left and then to the right as far as you can. And feel what happens to the arch of your foot as you get to the end range to the left rotation, as you get to the end range of the right rotation. You'll start to recognize that eventually enough of that motion is going to have consequences down the kinetic chain until it gets to your foot. Now imagine this. Imagine you can't rotate very well through your thoracic spine. That lack of mobility in the thoracic spine gets compensated elsewhere in the kinetic chain, and your foot can be paying the price for that. I can tell you this, when you talk about mobility and stability, it is very uncommon for the thoracic spine to be too mobile. Almost never occurs. If you're going to have a dysfunction at your thoracic spine, it's going to lack mobility. It's going to get locked down. It won't rotate very well. And the biggest at-risk parts for your thoracic spine are the closest neighbors. If you've had low back pain and neck pain, you better be looking at the thoracic spine. That is the common denominator for both those issues. But if you've been dealing with foot-related issues, it could actually very well have contributions from poor mobility at your thoracic spine. Okay? So let's go finally to the ankle foot itself. Now take a look at this guy. On the right, you see good alignment. On the left, you see poor alignment. This particular gentleman has a flat arch. Instead of that heel being straight below the lower leg, you're seeing this angled one. So this thing is everted and the arch is dropped. It creates what's called valgus at the knee, a little knock knee on that thing. The hip's out of alignment. That creates this little curvature at the spine. The shoulders are off a little bit. You can see that changes at the foot have an impact, can have an impact all the way up the kinetic chain from the foot to the head, okay? Now, I'll tell you this. There are some people that just have bad feet. Some of you are born with it. Sometimes it's acquired over time. And there are ways to make that foot move better. If it's not moving the way it should, we need to mobilize it. If it's moving too much, we need to find ways to stabilize it. I will tell you that more often your foot is stiff and needs to be mobilized than it is too mobile and needs to be stabilized. And so as a result, I think too many people get arch support. I think we got to work on the motion issue first. I will tell you that most people, though, with foot issues at the root still have a hip problem. So a majority of people with foot-related issues, it actually is a hip-related issue. Okay? So again, we don't want it to be too mobile. We don't want it to be too stiff. If you've got calf tightness, it changes the way that you get through your foot. You might be up on your toe. The heel lifts more quickly. That creates movement stressors down the chain into the toe itself. Footwear that supports your natural foot function is really, really important. The bottom line is this, folks. If you've had these issues and you've done either the normal thing, which is ignoring it or trying to alter it, or maybe you have sought help and you've done the traditional thing, which is see the doctor, get the medication, get a diagnostic test, maybe get an injection, see a specialist. That's all well and good. But if those people have not gotten to these mobility-related issue items, you're probably missing the mechanical thing or things that are contributing to this problem. If you've sought help and no one's looked at how your hips move and how your thoracic spine moves and how your ankle moves, that's probably a problem. And we need to find ways to undo those things. So what does successful treatment look like? Well, you're not going to be surprised to hear me say at this point that eliminating the pain requires, in the long term, finding and fixing the root cause. And so the most common treatments aren't really effective because they don't get to the root problem. You can see here three things I've already talked about: anti-inflammatories, injections, and surgery. Orthotics as well. We can take some stress off some tissue for a while by using orthotics, whether that's an arch support or a walking boot. And sometimes that's necessary to get through the acute phase. But the orthotics don't fix the mobility-related issue. And so when they talk about orthotics, if you do the research, you'll find they have a 50% success rate. I'm putting success in quotes there because their successes maybe doesn't make it feel better. I don't think it's truly successful in making you function better. So as a result, that would be temporary success at best. These all mask the problem. They don't get to the root of the problem. For you to get to the root of your foot problem, we need to look at how you move. We need to find the issues where you lack mobility or stability and restore most stability so that that body part's doing what it needs to do and doesn't pass the buck to the neighbors. So that requires looking beyond the area of pain. We got to have a more holistic, whole body approach, a global perspective. And the process of getting better is a process that goes through phases, and those phases should be both educational and empowering. There are some things you got to do at the start, but as your body changes and that area improves, we got to do other things. And you learn to do the right thing at the right time to get the right response. In our world, it is appropriate and legal for us to see multiple people at the same time. It's called group therapy. I'm telling you that if you have these issues, musculoskeletal issues, you don't want that. You want someone who's working one-on-one with you that can give you the intervention that you need. If you've been given a series of exercises to do because you've been told you have heel pain and this is what you're supposed to do for that, I'm going to tell you respectfully, there's no one set of exercise for heel pain. Those exercises are determined with a one-on-one approach that says, here are your dysfunctions. We need to fix this in order to take the stress off this tissue. Then you can feel better. There can be hands-on techniques that we use. Those things are good. Ultimately, though, because we exist between gravity and the ground, those activities need to be bigger, functional. We need to combine hands-on activity with movements where all these parts are kind of working together in harmony and synchrony with each other. There's actually one other treatment that I would say for those of you, particularly if you have Achilles tendon or arch-related issues, we use a treatment called A-stem. The research shows that when you use these tools and push through the tissues, it actually stimulates a healing response where the tissue will, by stimulation, cause the blood vessels to release chemical factors that help the tissue heal, so the tissue gets stronger. Remember I told you that plantar fasciitis really isn't an itis, it's an osis. That tissue can't handle tension stress, so it breaks down more readily over time. The A-stem helps that tissue get tougher and stronger so it can handle tension stress again. So if you've dealt with Achilles and heel or arch-related issues, I would strongly encourage you to consider a functional treatment approach that includes this instrument-assisted tissue mobilization, A-stem, as well. Now, we've given you lots of good information. Hopefully you found yourself nodding your head quite a bit throughout tonight's session. I don't think we solved all the world's problems yet. I know there are at least 3 more problems. One of them is there's no way you can retain all this information. Our memories are limited. You can't do that. The second thing is I've told you what the most common conditions are, the most common causes to this, but I can't assess you virtually in this way. So as a result, you don't really know what your problem is. And when I was a kid, there was that Schoolhouse Rock stuff, and I think they talked about knowledge is power. It's a good saying and it's catchy, but I'm going to tell you that knowledge is not powerful at all. Implementation of knowledge is. And so you've received some knowledge here tonight, but you've not been given the tools to implement that knowledge, and it's impossible to do so in this environment. And so I want to extend to you a gift for being here tonight. If you want to sign up tonight, we will give you more personal time. Now, here's the deal, 20 minutes with one of our foot pain experts with some simple questions and hearing your answers, and then doing some basic movement assessment, looking at how your feet move, how your hips move, how your thoracic spine moves, how other things move. We can easily in 20 minutes tell you, here's your foot pain type. Here are the things that are probably causing that, which means to make it better, here's the process you need to go through that probably doesn't require medications, injections, and surgery. We need to get the mechanical stress off that tissue. And in that 20 minutes, hopefully you'll gain direction, confidence, and finally some hope that there's something you can do about this that will have a long-term impact. This has a $150 value, but the best news is this, I'm not going to charge you a thing for it. If you sign up tonight, we'll do that for absolutely no cost at all. So we'd like to give guarantees. Since you're not taking your money, I can't give you a money back guarantee, but I'll do this. We like supporting local businesses that, like us, transform lives and restore hope. If you do this 20-minute screen for free and you find that it was not helpful at all for you, our guarantee is this. All you got to do is tell us that, hey, that didn't help me at all. And we will give $150 to the charity of your choice. That's our guarantee to you. Now, I would tell you this, to me, if you've had enough of a problem long enough that you've said, hey, I'm willing to listen to this guy talk for an hour, I would strongly encourage you just to do that free screen to get the personalized approach to do that. At the very least, you'll get a summary sheet that says, here's the type of problem, here's the implementation plan and what it would look like. You can take that home with you after that. So you'll have that. But our goal with that is to figure out if our approach is going to be successful for you. And so here's your opportunity. All you got to do, folks, is if you can get out your phone and do the QR code and go in there. That goes to a link where we get information sent directly to us about you. The simplest way to do this, though, if you say, yes, I'd love to see someone spend 20 minutes and learn how to personalize this, just click on that chat button and say, I want in. We'll get your name from that. We do need to know where you'd like to do this, though. So we have 8 clinic locations. So you can pick your clinic, too. We've got Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, Albia, Centerville. So if one of those 8 clinic locations works best for you, make sure you list that as you put that chat down too. If you're not very close to any one of those locations, we can do a virtual assessment. So you can say, yes, I'm in, I'll do it online. You have the technology because you've listened to me tonight. If you can turn on your camera, we can see you. There's some easy movement tests we can do with you that will give you a good idea as to whether or not this mechanical cumulative trauma, get to the root cause approach is something that's going to be worth you spending more time doing. Okay, folks, I've gotten a number of you that are signing in. So let me see. I'm going to scroll back here. Brenda says, Newton, Iowa. Okay, Brenda, we'll have our care coordinator in Newton call you and find a time that works well for you. Carol, Ella, that's great. We will get you in there. Kirk, Des Moines, we'll get you called, Kirk. Ed says, I want in. Ed, I don't know you've told me a location, so let me know, Ed, where you want to be. Aaron's going to be seen in Newton. Mike, Des Moines. Kyle, I know where you live, Kyle. We'll get you in Pella. Holly in the Ames Clinic. That's awesome. Holly, are you in relation to a football player at the University of Iowa? That'd be kind of cool if you were. So yeah, anyone else, let me know. Oh, there you go, Ed. You're in West Des Moines. Is Des Moines location okay then? We're just on the border between Des Moines and West Des Moines on 6,000 grand, so it's pretty close. Okay, oh, you know what I'm talking about. There you go. Ronette, you want in Pella? Good job. We'll get you in, Ronette. Anyone else, let me know. We're going to close this down. I really appreciate your time. Recognize that we're going to be sending you another email tonight. On that email, there's going to be 3 things. There'll be a link to this session so you can review it again. I'm going to ask you a favor, though. If you got value out of this and you know someone else is dealing with foot pain, would you please forward this to them so they can listen as well? Here's the situation. In America, today, 54% of people are dealing with musculoskeletal issues, pain and movement-related issues. You know how many of them get the help that they need, this mechanical approach? 46%. 4 to 6%. There's a whole bunch of people out there suffering unnecessarily. We need to reach more of those people because this stuff is unnecessary. Now, remember, if you've been dealing with this pain for months or years, if you got pain at 6, 7, 8, it might take a little bit more time. But when you take tissue stress away and you can continuously relieve stress in that tissue, you will feel better and you will function better. I'm not going to promise you're going to move like an 18-year-old again. But if we take the stress off the tissue, I can promise you that you will feel better and function better than what this path has led you to at this point. Now, if you want to reach out directly to me, you can respond to that email you're going to get here in a little bit. You can write down this email address there, troyvm@kineticedgept.com, gets directly to my inbox. That's my cell number right there. So if you want to text me or call me at any time, at the very least tonight, folks, I want you to know you have a resource. Now, it might not be ankle and foot related, if it's knee, back, hip, whatever. If you have questions, I and Kinetic Edge want to be your musculoskeletal resource. We can get you answers that impact you for the long term. Brenda, you're welcome. I appreciate you being along tonight. And to all of you, thank you. I know your time is valuable. I appreciate you giving me an hour dealing with our chat-related issues. I'm glad we got that figured out here eventually. Blessings to you. Have a happy holidays. Happy Hanukkah if you celebrate that. Merry Christmas to all of you that celebrate that. Hope your season is really healthy, and hope you find some solutions for your foot pain as well. Take care. We'll see you soon. Bye-bye.